everyone, welcome to my Day in the Life series here on White Coats and Corgis. Most of you probably know me from Instagram or TikTok, where I make helpful free content for pre-meds and talk about my journey as a first-generation medical student. My mission here on YouTube is to give pre-med students all the information they need for a career in medicine. So in order to do that, I've teamed up with MedSchoolCoach to create this series where I'm going to do a deep dive on each medical specialty. And I want to start off by saying that it can be really difficult to accumulate the number of shadowing hours you really need to be accepted into medical school. And especially nowadays, this can be really challenging. A lot of physicians aren't open to shadowing opportunities in person the way that they were before. So that is why MedSchoolCoach decided to collaborate with over 20 doctors to give you a behind-the-scenes look at practically every specialty that you might be interested in. And this is all completely free. You can go to shadowing.medschoolcoach.com, register for the program, and then you get to choose whichever specialties you're interested in to shadow. At the end, you can fill out a short quiz, and then they'll give you a certificate of completion. That way you can count these hours on your medical school application. Okay, so without further ado, let's learn a little bit about diagnostic radiology. So in 2022, the match had more applicants applying for radiology than they had positions. So it came out to be about 1.36 applicants for every one position. And if you're wondering what you need to do to make yourself successful in the diagnostic radiology match process, the average matched applicant had 6.9 volunteer experiences, 3.3 work experiences, and 3.8 research experiences, which kind of broke down to 6.4 abstracts, presentations, and publications. So overall, this specialty is considered kind of in the medium range for the number of publications that you need in order to be competitive. And the last point that I want to bring up is the average salary for a diagnostic radiologist, and that came out to $427,000 a year. And obviously this is variable, and there are a lot of other reasons to consider going into a certain specialty. So to talk to us a little bit more about those other things, today we're going to hear from Dr. Ed Lipsett, who is a diagnostic radiologist, and he is going to take us through some of the factors that he thought was important to consider before deciding if becoming a radiologist is the right career path for you.
So why radiology? Well, I have to tell you, there are many different reasons, but what I can state and what I witnessed, what I observed when I was trying to choose an area within medicine, that radiologists, they tend to be a fairly happy lot. They find it to be fulfilling and rewarding. And a recent survey, I think this was conducted by Medscape, they found that by far a majority of radiologists were pleased with their career choice. And even though the hours can be long and the work can be difficult, nonetheless, there's a great deal of satisfaction. So why did I choose this career path? Well, there were some elements that I think were specific maybe to my personality, but I really found the technology to be fascinating. Medical imaging is technology driven, to be sure. And the changes that I've witnessed over the course of my career are just staggering. That also poses a challenge, of course. You know, you have to keep up, but if this is the kind of thing that interests you, certainly a career in radiology can be very fulfilling, again, if you're technology driven. I love problem solving. I consider myself somewhat of an analytic individual, and you're constantly solving sometimes very complex medical problems, but I enjoyed that. I think a radiologist is the doctor's doctor. And what I mean by that is that clinicians are incredibly dependent upon medical imaging. Whether internal medicine, surgeons. I find that really all roads do lead to the radiology department. Always consulting with clinicians. Medical imaging has become just a cornerstone of diagnosis. There are multiple practice scenarios, which I'll get into a little later. And for me, being part of a team, a group effort, collaborating, is extremely rewarding. And as a radiologist, you're always collaborating with people in all different areas of medicine. Now, it's a long training period. I mean, following medical school, radiology residency now is a 5-year residency, and that's after obtaining your medical degree. Now, the majority of residency graduates, they then often pursue a subspecialty fellowship after graduating from their residency. So we're talking about 5 years, but then often a 6th or a 7th postgraduate year in order to subspecialize. So to summarize, it is competitive. At the minimum, it's a 5-year program. Fellowship is highly recommended. And there are about 195 programs in the country with about 1,200 positions. So if you do the math, 6 or 7 positions usually for most of these radiology training programs, these residencies. Now, some of the areas that you can go into, I'll go through this very briefly, but I think it illustrates the number of areas that you can go into. Women's imaging, area that I went into. I enjoyed the challenge of ultrasound, mammography, bone densitometry. So this is an area where it's a subspecialist area, usually a 1-year fellowship following residency. Interventional radiology. If you're a frustrated surgeon and you want to go into radiology, but you also want to be dealing with patients, you don't mind doing invasive procedures, interventional radiology has become an extremely popular subspecialty area within the field of radiology. Musculoskeletal imaging. Again, if you gravitate towards the orthopedic medicine, musculoskeletal imaging will probably be the area that you might gravitate towards. Neuroradiology. Well, for many, many years, neuroradiology was a subspecialized area within radiology. Now, this is something new. Emergency radiology, because medical imaging has become plays such a crucial role in the diagnosis of acutely ill or injured patients in the emergency department. So this is actually a new specialty that's been carved out. My responsibilities included, yes, teaching, quite a bit of teaching, medical students, fellows. Also, I kind of missed the participation in conferences, which are a key element in the training of radiologists. 2 or 3 conferences a day, because seeing a variety of cases is critical to becoming an effective radiologist. You have to see a large number of cases. You have to see what entities look like, and so not only in academic radiology was I performing procedures and interpreting cases, but also reviewing cases and teaching. We called it conferencemanship, and it's a very important part of academic radiology. Now, what would my a work day be like? Well, certainly in private practice, there was a lot to do, and I would have to hit the ground running in the morning, and our days were long. But, of course, interpreting examinations, but also consulting, reviewing patient information, trying to piece it all together, communicating the results. That's very, very important. I would also supervise and teach medical students. Even in private practice, I would have medical students rotating through our offices. Now, if you do want to perform procedures, then you have to take the responsibility of treating patients and the complications that might occur. And if you really wanted to be hands-on, of course, you could perform interventional procedures, which included angioplasties, nephrostomies, image-guided biopsies. There's so much that you can do. It's much, much more than just sitting in a dark room and looking at a view box or workstation. Now, as I said before, the work environment can include hospitals, or it could be outpatient imaging. There are research opportunities, especially if you go into academic radiology, both basic science and clinical. And I wanted to throw this slide in here because, again, for me, some of the greatest satisfaction that personally that I derived was by being a member of a team, the collective wisdom of a group, collaborating both with people within radiology and also the clinicians that I work with. Now, the advances in imaging, at least during the course of my career, absolutely mind-boggling. Now, here's a slide from probably the 50s where, what we were dealing with was basically conventional X-ray imaging on view boxes. Mm-hmm. And look at this. And here we're talking about cross-sectional imaging with highly sophisticated equipment. Now, why this fellow was in a hazmat suit, I don't know. Now, briefly, just show you a few examples. This is simply the chest X-ray that is performed using conventional radiography. Cross-sectional imaging, when we talk about cross-sectional imaging, we're usually referring to computed tomography or magnetic resonance imaging. And here you can see basically a cross-section of the abdomen. I wish that the machines would label the organs for us. They don't. But in this case, of course, you're seeing liver, you're seeing pancreas, tail of the pancreas, spleen, kidney, spine, vena cava, aorta, and this is a cross-sectional image. Now, one of the benefits, of course, of this cross-sectional imaging, and here a patient is having a CT exam, you'll notice that even though we have the cross-sectional image, we've got a sagittal image of the spine, and here's a coronal image of the spine and pelvis, kidneys, spleen, liver. We reconstruct. These are digitized imaging studies. So we take the information, that's why it's computed or computerized tomography. We take a slice, we have information, and we can reconstruct. And the ability to image the human body in an almost infinite number of scan planes is a remarkable breakthrough. And that's one of the reasons that cross-sectional imaging is so valuable in making a diagnosis. Same thing with MRI. It uses magnetic resonance, not ionizing radiation, but we generate robust images, and again, in an almost infinite number of scan planes. Now, ultrasound, it's a terrific technique in that there is no ionizing radiation, so it's certainly appropriate to use in obstetrical sonography, and here we see a fetus lying on its back. You can see some of the facial features right here. So ultrasound is a very, very important imaging tool because one places a probe on the skin surface. It's very, very operator dependent. But again, we're not limited by scan planes, and we can generate images basically in any plane that we want. Now, we could also apply ultrasound to vascular imaging, which has been of tremendous benefit. You know, here we see an ascending aorta, descending aorta, and with ultrasound, we can see a cross section of a vessel. And here's longitudinally abdominal aorta, superior mesenteric artery, celiac axis. We generate phenomenal images, again, using ultrasound. Here we go. So here's a 78-year-old male who presented actually in the ER with abdominal pain. And on physical examination, it was thought that maybe there's a palpable mass. Interestingly, it wasn't particularly pulsatile. So when we did our exam, we rushed the patient to the CT suite. And what you see here is this white rim, It's a cross section of the abdomen. So what lives in front of the spine?
Aorta.
Exactly. And here you see a calcified abdominal aorta. One of the reasons why it wasn't very palpable, why it wasn't pulsatile, was that there was a lot of calcification in the aorta, a little bit of leakage of fluid. This is a leaking abdominal aneurysm, which was readily diagnosed, utilizing CT, and not only the extent of the aneurysm, but also the fact that we were dealing with the leaking aneurysm, and this was a medical emergency.